Welcome back to ABC-7 at 4. I'm Nicole Gomez. HPV is a common virus that can lead to cancer later in life. And joining us now is Dr. Ogachika Lozi from Sunset West to talk about HPV. Thank you for joining us.
Thank you for having me.
Well, Dr. Lozi, 79 million Americans are currently living with HPV, correct?
That is correct. Remember, that's just an estimate. Whenever we talk about estimates, it's usually an underestimate. I think what's important is that a lot of people don't realize that HPV it's just common. Once you've had a sexual intercourse or sexual activity, close contact at any point in time, you have a high risk of having it. Oral HPV is more common in men than women due to various activities. Typically, however, it clears on its own, but it can be a persistent infection, and that's where we'll talk about Pap screenings later in this comment.
Okay, more than 9 out of every 10 cases of cervical cancer are caused by HPV. So talk to us about some of the causes.
Well, you can see here, right, that if you have HPV, it can lead to precancer, cancer, and deaths. What people don't realize, it can also lead to penile cancer, vulvar cancer, vaginal cancer, and anal cancer. So it's not just a question of cervical cancer, but there's a host of other cancers that it can drive.
Okay, so Texas Tech University Health Science Center conducted a survey. Just talk to us about what that survey, what was found in that survey.
So really interesting. About 585 people, almost 600 women were surveyed and tested. And what's unfortunate is that 53% were positive for any HPV. And these are people that could have been eligible for the vaccine at one point in time. What's scary about it is almost 16% actually had high-risk HPV, which are the variants of HPV that specifically cause cervical cancer.
Okay, so talk to us about the HPV vaccine and its effectiveness.
Yeah, so it works great, right? So since we've had the HPV vaccine approximately over the last 15 years, it's dropped the rates of cervical cancer by almost 90%. What's important, though, is that you get it on time. Usually between the ages of 11 and 12, it's actually been extended up to 26, and recently has actually been extended up to 45 years of age as well.
Okay, so how can HPV infection lead to cervical cancer? That's the question.
Well, first of all, the virus itself can lead to what's called dysplasia, or can change the cell type in the cervix. What's important when you think about HPV vaccines is when to get it. If you look at the bottom, you have a little window really between 11 and 12 and then all the way up to 46 where you can reduce the risk of those cells changing type, and by reducing that risk, you can actually stop the progression of HPV, and I think that's the critical point, right? A lot of times we talk about, hey, don't smoke, don't drink, don't do this. There's no vaccine for smoking, drinking, or heart disease. There is a vaccine for this, but parents have to be willing to take it.
Okay, so I think you may have missed it, the time that we should get the vaccine.
So the important time, right on the slide, right on cue, right, is the HPV vaccine schedule, right? So you can see 9 to 14, it's a 2-dose, or if you're 15 to 26, it's a 3-dose. It's actually been extended up to 45. We don't really talk about that as much because that's a physician-patient conversation, but for parents listening to this specifically, really target between 9 and 14.
Okay, so the amount of people that have decided to get the HPV vaccine, has that increased since it was first introduced?
Absolutely. So the rates are going up, but what's really important is if you look at this, the reduction, right? So among teenage girls, 88% down. Amongst young women, 81% down. When I talk to my colleagues out there, they should really recommend the HPV vaccine for all patients aged 11 to 12. It used to be only females, right? But it's now women and men, and this is specifically because, like we talked about earlier, you can get penile cancer, vulvar cancer, and a host of other cancers that are not cervical.
Yeah, I remember growing up hearing it more about females, but now that has changed.
It's across the board now.
So let's talk about some of the guidelines for Pap screening.
Yeah, so if you're a female out there, have this conversation with your physician. But the standard is really once you hit 21 to get every 3 years. There is a way to stretch it when you get a Pap smear and what's called an HPV specific test. It actually tests the DNA of the HPV. Then you can stretch it to 5 years. Whatever the case, have a conversation with your physician. If you've had a hysterectomy, definitely have a conversation. And if you talk about prevention, right, prevention is always important. Smoking's there, safe sex, wear a condom, and really get a Pap smears when you should.
Okay, let's talk about some of the resources so we can wrap this up.
Absolutely. So a host of resources there. I will talk about specifically.
Yeah, let's talk about the resources.
There's a host of resources on this slide, whether it's Immunize El Paso, whether it's Texas Tech. I'm almost obligated to sort of talk about my other boss, Dr. Maloko, and her group at Texas Tech that just got $3 million to specifically focus on those that don't have the financial means to get pap smears. It's called Tsukasa, I think, and they're doing a great job.
I'll get that information posted on our website.
Exactly. It'll be posted on the website, and they'll know about it. But again, multiple resources, whether you have financial means or not, it's important because prevention can save your life.
All right. And if you have a question for Dr. Alozie, all you have to do is send us an email at news@kvi.com. Dr. Alozie, as always,
thank you.
Thank you for
I had
joining
less
us.
gray in that picture. Time's going fast.
No, you're fine. Still ahead on ABC-7 and 4, Washington.